Okay, I think we're streaming live right now. I'm just going to wait one more minute until it pops up. It says we're going. Okay, we are going live. Okay, hello TLC, how are you? Happy Tuesday. I love coming at you doing these lives with different experts because then we can give you so many more topics and information. I know skin right now, especially with summer, and our diets, many diets have changed during COVID. And so we are so lucky to have Dr. Melissa here with us tonight. And Dr. Melissa's been with us a few times. So if she looks familiar, here she is again. She's also come in to talk about stress and hormones and sleep. So if you have any questions, Dr. Melissa will also introduce herself and tell you a little bit more about what she does, but feel free to reach out to her personally, send her a DM, and we're also obviously taking questions in the comments below. So I'm going to monitor the comments and questions, and then we're just going to fire them at her during the presentation, and if we have any questions at the end. So if you are there with us right now, welcome. And if you're just joining us and you didn't even know we had a live, even better. We usually come live every Tuesday night with a different expert. And so I'm going to hand it off to you, Dr. Melissa. Tell us a little bit about you, and then we'll dive right into the skin tonight.
Thanks, Vanessa. Okay, so let's get it started. So as Vanessa said, my name is Melissa. I'm a naturopathic doctor in Toronto and Oakville. A little bit kind of about my practice is that I really like to empower my patients to kind of take control of their health. And I really feel like I'm just kind of a witness to their health journey, and just kind of, because really the patients do all the work, and I'm always amazed with how much people can do. And in my practice, I like to help people with energy, weight management, digestion, a lot of skin health, which is why I'm so excited to be here today. And then one of the clinics that I recently joined, I focus a lot on male fertility. So that other half that we tend to kind of forget about. And then I did extra training in IV therapy and injection nutrients. So I'd use that also in my practice. So for today's talk, I wanted to talk about kind of the main 5 factors that I find affect skin health that I usually go over with patients and maybe sometimes is overlooked. So the first one is kind of, as the webinar title said, skin side out. So going from the outside, what's touching your skin, what's influencing it from the outside, and I'll go through some factors. And then what's happening on the inside of your body, because for skin, I find it's really what's happening on the inside will express itself on the outside. So through diet, talking about not just diet, but supplements and prescription medications and how they might be negatively affecting your skin, because we know so many things for skin benefit, but you may actually be taking something that's maybe not helping your skin. Certain health conditions that should be addressed, and if aren't, no matter how much cream we're putting on or topical things, it's just really not going to work that well. And then the last one is time. So going over kind of how your skin changes as you age and how your skincare routine should maybe change as you age. And then definitely some time for questions, or feel free to ask questions during too. So the first thing, before I kind of dive into those 5 factors, I wanted to talk a little bit about skin itself. So I think everyone knows kind of skin is the largest organ. It's the physical barrier, along with your digestive system, between your body and the outside world. It's made up of 3 layers of skin cells: the epidermis, the dermis, and the subcutaneous tissue. So that's kind of the physical skin cells. But I feel like this is becoming more and more popular, and I don't know if you already know about it, but there's actually another thin layer on top of your skin called the skin barrier layer. So it's actually very, very, you can't see it or anything, but it's on top of your skin. And that skin barrier layer is made up of 3 layers on its own. So the first one is the microbiome. A lot of, research, and people are starting to become more aware of gut flora and how important it is for your overall health. Well, there's bacteria on your skin also that can be very important. So it prevents pathogenic bacteria, so bad bacteria, from kind of overgrowing and causing inflammation. It influences the immune response in your skin, which also affects inflammation. So making sure there's a good balance of beneficial bacteria on your skin is important. And then the second layer is actually it's called the acid mantle. And your skin is actually a little bit more acidic, and that's because it's to provide kind of antimicrobial activity and to activate enzymes in your skin to help with maintaining skin health. So maintaining that skin pH is really important. So an example of a condition where the skin pH is increased and becomes more kind of basic and it causes issues is diaper rash in kids. So the skin pH becomes a little bit higher, it's thrown off, there's more bacteria, and then you get the rash and the discomfort and the inflammation. And then the last layer just on top of your skin is the lipid barrier layer. And this one really affects kind of moisture, keeping water in your skin. So it's called transepidermal water loss. So you're not losing water from evaporation, and also is a little bit antimicrobial too. So that's kind of, I'm going to come back to this kind of with every factor I'm talking about and how it affects the skin barrier layer. So the first factor is environment. So what's going around you. So when we think of environment, definitely weather. So, you know, especially in the winter, it's really dry already. And then we have artificial central heat, that's even more dry air. And that can really aggravate someone's skin if they do already have dry skin. Even in the summer, going from hot and humid outside to really cold and dry air conditioning inside, keeping in mind that that can aggravate your skin. Physical irritants. So, you know, it's summer, we're outside, we're camping on the beach, or so you're exposed to kind of dust and pollen. And these are actually physical irritants that can cause your skin to react either from allergy or cause itching. So then you're going to itch your skin, you're going to affect that barrier defense layer again and cause inflammation. And then the last kind of physical contact to your skin that I'm finding is more and more common with patients. And because of COVID, we're all wearing more masks, is something called maskne, which they've termed because they've seen so much more aggravation of the skin when people are wearing the physical mask. And it's actually, there's a type of acne associated with it. It's called acne mechanica. So it's from a physical surface or something physically touching your skin. And what it is, it's kind of like the heat, the humidity from your breath, from sweat, from makeup, all kind of mixing and staying under the mask and sitting on your skin. And this can really affect bacteria growth, cause acne, inflammation. So some tips that can really help prevent the acne from forming when you're wearing masks is number one, trying to wear 100% cotton mask, so it's breathable at least. Washing your mask every time you wear it, which I feel like a lot of people don't do, or they'll put it in their car and they'll just keep it, and whenever they run to the grocery store, they'll kind of put it on. Making sure you wash it after every single use is really important to prevent the bacteria kind of growth on the mask. And then no makeup. No one can see your face anyway, so no makeup if you can underneath the mask. A very light moisturizer can help as kind of a barrier for bacteria. And then trying to avoid putting serums on your face right before you put the mask on. So especially serums that are irritating like vitamin A, vitamin C, because then when you put it on and then put the mask on, it actually amplifies the irritation from those serums. So really trying to keep it as simple as possible. But overall, please do wear a mask. The option is not to not wear a mask because we wear them for a reason, and it does help stop the spread and keeps everyone safe around you. So wear one, just keeping in mind to have clean hygiene practices with the mask, treating acne if it comes up for you. And acne really always does have an underlying hormone picture sometimes if you tend to get acne really easily. So addressing that can help too. Okay. So another thing that's in our environment a lot is sun, and it's in this summer right now. And there was a quote I read, I think it was by Jennifer Garner, but it was, nothing looks better in your 50s than sunscreen in your 20s. Because actually up to 80% of your sun damage and sun that you get on your skin happens in your 20s. So it's really, you know, in our 20s, I'm sure everyone did tanning beds and all those things. And unfortunately, we should have been protecting our skin as much as we could, but we can still do it now. And so we all know the kind of the risks of sun exposure, skin cancer, pigmentation, increased vascularities, especially like around the nose, seeing more kind of veins and thinner skin, and definitely premature aging with sun exposure. So you want to, if you're wearing sunscreen, one, you want to wear it every day, all year round. On your face, a lower SPF. I'll talk about this a little more, but because the higher ones can be heavier and kind of block your pores more. So, SPF 15 to 20. And then reapplying it every 2 hours if you are outside all day or if you're sweating a lot. And then even if it's cloudy outside, up to 80% of the sun UV rays can still reach your skin. So still putting sunscreen on if it's cloudy outside. Now, one of the questions I tend to get is, well, I don't like to wear sunscreen because I want to make sure I'm getting all the vitamin D I can, and it blocks out vitamin D absorption. It's true, we get most of our vitamin D from the sun. You can supplement it with it also. And there is a lot of benefits with vitamin D. It's been shown that people with higher levels tend to have less internal cancers, which is a benefit, beneficial for diabetes prevention, multiple sclerosis, and autoimmune conditions. But I think when it comes to vitamin D, they've actually tested, number one, people don't tend to put sunscreen on completely evenly. So you're not blocking out 100% of the vitamin D absorption. And I think the best thing to do would be to get your vitamin D level tested by a naturopath, and then supplementing up to the level where you need it to be and wearing sunscreen. So don't, try not to not wear sunscreen just for vitamin D, and to protect your skin is really important. And then when it comes to kind of how much sunscreen should you wear based on skin type, because some people burn more easily than others, there's a scale called the Fitzpatrick Skin Scale, and it's from the 1970s. And what it is, it estimates your skin burn time based on skin color. So it kind of goes from a scale of 1 to 6, 6 being the lightest skin tone, 1 being the lightest skin tone, 6 being the darkest skin tone. And they show that people with lighter skin tones, like a skin type 1 versus 5 or 6, are actually 70 times more likely to develop skin cancer than darker tones. And one of the main reasons is you have less melanin, which is kind of the color pigment in your skin. This is kind of genetic. And melanin is actually a natural type of SPF. It absorbs UV rays from the sun to prevent kind of damage to your skin. And on its own, when you have darker skin, it's almost like an SPF of 4. Like, it actually does protect your skin a little bit. So the lighter you are in your skin tone, you want to definitely wear lots of sunscreen, a higher SPF. And then if you're darker skin tone, sunscreen is still important, but you're less likely to burn, less likely to get skin cancer, but you are more likely to get scarring, pigmentation. So if you're undergoing, laser treatments on your face or different things like that, it's really important to know that you're more likely to get scarring and pigmentation. So that's kind of the opposite as opposed to light skin. And one thing we do at my clinic in Toronto is you can actually objectively measure how much melanin content you have in your skin. So we have a machine called the SD202, and it measures melanin. So then instead of just kind of trying to look at your skin and figure out what skin type you are, we'll measure it and we can know what skin type you are in what category. And then it also measures things like lipid content, so how oily your skin is, hydration, how much water, and how much redness. So if you tend to have redder, thinner skin, and it's nice because then it can really help target what topical treatments we're going to use. And then to see the change, because you're getting like a number, you're getting an objective measurement. So then still talking about environment, the number one factor affecting your skin is what you're putting on your skin. So what products you're using, and the 3 questions you should ask when it comes to your products is, 1, are they clean? So what ingredients are in them? So there's so many chemical compounds and things that are used in beauty products that can disrupt your hormones, can be carcinogenic, can aggravate your skin. So there's websites like the Environmental Working Group, which is a nonprofit organization, and they have a section on their website called Skin Deep, or you can go to Think Dirty. It's a website or an app, and you type in any of your products and it'll list all the ingredients and rate them on their safety level, their clean level. And this is, I always recommend all my patients to do. And if they are dirty, we throw them out and get new ones. So 1, are they clean? 2, are you using them correctly? So are you putting them on in the right way, going from from the toner to serum to cream, and then SPF, kind of making sure you're putting them on in the right way so your skin is absorbing it. And then, what time of day are you using it? So vitamin A and vitamin C can make your skin more sensitive to the sun. So using those at night and not in the morning, that type of thing. And then lastly, which I think is maybe the most important, is, are they the right products for you? So just because, you like your foam cleanser because it makes your skin feel really squeaky clean, you may be stripping all of the oils from your skin and kind of affecting that skin barrier level and causing acne to get worse. So you don't always want to be using harsh products depending on your skin type. And then I've also done food sensitivity testing with people, which is more oral and related to kind of diet and digestion. But things like aloe come up, or certain herbs, and these herbs are in their facial products. So making sure, it's not that it's an allergy, but it could definitely aggravate your skin. So knowing what product to use and which one is right for you is super important. So now, kind of going to the inside, talking about diet for your skin. So the number one thing for me personally, and that I've noticed with patients, and you just see a huge benefit from it, is water. It sounds so simple, and I feel like everyone could drink more water. Everyone wants to drink more water, but just you forget and it's busy. But there aren't actually a lot of studies showing that drinking more water helps skin. But we do know that water itself is needed to provide energy to your skin cells, to activate enzymes, to maintain your pH balance. It influences hormones and nutrients in your body, flushes out toxins. So if you are trying to moisturize your skin, do it from the inside out and try to drink as much water as you can. 2 to 3 liters a day is always good. The other thing in your diet that's really important is protein. So protein, one, is needed for your skin to heal. So if you have a lot of acne or inflammation, your skin's always trying to heal itself. So you need protein for that. And then specifically amino acids proline and lysine, which are the building blocks for collagen. So collagen is that kind of strengthening, stabilizing protein in your skin. It's also in different organs, hair and nails. It's actually 30% of your body's dry weight. So it's a really big percentage. You want to make sure you're eating things that will help your body build more of it. And then specific nutrients in your diet. So vitamin C, it's really good for collagen production. It also increases absorption of other nutrients like iron. Vitamin A is actually kind of one of the dominant skin vitamins, but you do have to be cautious with it. You don't want to take too much, especially around fertility and pregnancy. You shouldn't be taking vitamin A, but it does help with DNA production in your skin cells and mitochondria, so energy production in your skin cells. And then copper, which is a mineral, and zinc. So zinc is really important for elastin synthesis. So kind of having that bounce back in your skin. Zinc can really help with that. It helps with cell turnover. So if you have very uneven skin or texture issues, making sure you're getting enough zinc in your diet. And then of course, omega-3 fatty acids have been shown to really help with keeping skin healthy, inflammation levels. If you have dry skin, dry scalp, it's really good for that type of thing. And then other things you can do for your diet, they're kind of secondary or kind of not directly related to skin, but can help, is supporting elimination pathways. So that's making sure you're having regular bowel movements and urinating often, so drinking a lot of water. So having enough fiber, cruciferous vegetables is important because it helps balance and metabolize hormones. And again, hormones can also really affect your skin. And then foods to avoid are the more inflammatory type foods. So like pork, fried foods, for some people, dairy, especially for kind of eczema and psoriasis, refined carbs, and sugar is a big one. It has been shown to help to kind of worsen acne. And because it increases kind of oxidative stress in your body and affects vascular muscle function, so it's more inflammatory. And then one thing I do like to do with patients to really figure out what foods work best for you, and I've talked about this in other webinars, is to use kind of a food sensitivity blood test and figuring out which foods to avoid for a little bit to kind of reset your diet. And then the third thing I want to talk about is prescriptions, so medications and supplements. So certain medications which you might be taking can have beneficial, and by no means I'm against prescription medications. I think there is a place and time for them, and there it can be very beneficial, but they also can have side effects. Like, for instance, if you're taking something for blood pressure, something like a water pill, which is actually a diuretic, it influences fluid balance in your body. So again, drying out skin. Certain medications, especially antibiotics, antifungals, antihistamines like Benadryl, can have photosensitivity side effects, so that it makes your skin more sensitive to sunlight. And not that you'll burn more easily, but it actually is kind of, it's a reaction with the medication in your skin to the sunlight, and it can be very uncomfortable and very intense. Some medications are more inflammatory, especially if you already have a skin barrier defense, kind of, it's not as strong as it should be. So things like birth control pills, again, antibiotics, Accutane, if anyone's ever taken it, you know your skin, it's so dry and flaky, and even your lips and everything. So helping to manage that topically if you can. And then hormonal. So especially estrogen and certain hormones can stimulate a gland in your brain, your pituitary gland, to make more melanin stimulating hormones. So it actually produces more pigment in your cells, something like melasma. So if during pregnancy, you can kind of get darker spots on your skin with IVF medication, birth control pill. So knowing that there's something happening underlying that's influencing that, so that we can maybe address that instead of trying to do topical things for pigmentation or kind of darker skin spots. And then certain supplements, same thing, can have side effects. Even though they're natural, doesn't mean they are benign and have zero side effects. So St. John's wort is an herb that's really great for mild to moderate depression and mood, sleep, and menopause, but it has a very strong photosensitivity reaction. So not being, out in the sun without sunscreen, because you can definitely get very red and have a very serious reaction. Certain herbs have diuretic effects. So like uva ursi, which is an herb for urinary tract infections, dandelion leaf, which people use as in detox teas and everything. Again, a diuretic, so it's kind of dehydrating you if you're not drinking enough water. And there were some case studies on using injection B12, which I do use in clinic, but you have to make sure which form you're using, because it worsens acne. So knowing what form to use and how often and keeping that in mind is also important. And then the fourth thing to talk about is the fourth factor really that can kind of affect your skin is, of course, what's going on in your body. So certain health conditions or concerns. So menopause is one I noticed a lot, and because of the low estrogen in menopause, estrogen is a hormone that helps stimulate hyaluronic acid in your skin, which is very, very moisturizing and helps retain water. So with menopause, you tend to get drier skin, vaginal dryness. So help managing this, and then also managing estrogen levels and side effects of menopause can help with skin. Things like polycystic ovarian syndrome, which is an imbalance in hormones, because there's kind of excess androgens in your body and testosterone, you see more jawline acne and more kind of oily skin. It also causes more blood sugar dysregulation, so maybe more cravings for sugars and sweets, so then you're eating foods that are even making the acne and hormones worse. Thyroid function, so underfunctioning or overfunctioning, can affect skin moisture, if it's dry, and temperature. So addressing your thyroid is really important, and even if we try and treat your skin without doing that, it probably won't work as well. And then, of course, with eczema and psoriasis tends to be more autoimmune, so really helping regulate your immune system. And then with eczema, looking for things that are triggers, either in your environment or diet, and eliminating those can help also with skin. So the last factor is age, so time. And everyone wants to do anti-aging and how do I look 10 years younger, and which would be great if we could do that, but it's about kind of changing your skincare with your age so that you can help age gracefully and look the best you can. So the thing things that are happening when you're aging is that you're getting lower growth factors in your skin. which is really important for healthy skin, lower androgen levels as well as lower estrogen. So all of these hormones are lower, so you're getting much drier, no oil on your skin. So again, that barrier defense layer isn't there like it should be. But the good thing is with growth factors is in collagen production, it can be stimulated with facial acupuncture. So I don't know if anyone's ever heard of or tried cosmetic acupuncture, where they kind of use tiny, tiny needles and they put them on your face. This can stimulate local growth factors in your skin as you age. So it can be really beneficial for lines and collagen formation.
Do you do facial acupuncture at your office as well in Toronto?
I don't do it yet. I'm going to be certified in it soon, but there is at both of my clinics in Oakville and Toronto, there's another naturopath that does it.
Awesome. And what are there common trends in the ages that you see these changes in skin?
You know what? That's a good question. So it's not really like at 50, this is change. It's really, there's other things that can affect that. So, you know, like sun exposure, if you were really exposed to sun, or if you smoked growing up, your skin will tend to age faster. So it can happen at a younger age. And genetically also, it can happen, you get more lines and wrinkles and less skin elasticity younger based on genetics. So it's, you know, it's usually around menopause where you start to see a big change in your skin. But actually, you know, collagen after the age of 40, your body doesn't make as much or as good quality collagen anymore. So really, anytime after the age of like 35, 40 is when you'll really start to notice like, oh, like my skin is changing, or it's not like it was. You really notice lines a little more than you did before. So it's good to be proactive and actually start earlier. So in your mid 20s, if we all had started a little earlier, it'd be good for kind of prevention. And then again, things that can help as you age and at any age really is support with collagen synthesis. So getting the nutrients that can be really beneficial for it. So vitamin C, like I mentioned before, iron and zinc, which a lot of women are low in iron. So they don't really relate it to skin health and how it can really affect collagen formation in your skin. Zinc, again, a lot of people are deficient in it if you're not supplementing. Glycine and proline are, again, the amino acids that you can get in collagen. So actually eating collagen powder every day, like a scoop of it in your tea, in your coffee, in your smoothie, can be beneficial for skin. And there was actually a study on it that it helped reduce cellulite because it actually strengthened collagen in those body areas. So that's always a pro. The growth factors, so stimulating those physically with needles, androgen levels, helping, you know, with herbal supplements, we can help manage that. Selenium, another mineral for skin and thyroid function. And then there's just so many other ones. So making sure, you know, you're getting all the nutrients to support your skin and collagen formation.
Can you talk a little bit more about the growth factors and what were they, androgens?
Yeah. So yeah, the growth factors are a hormone and they just help your body exactly like when you're younger, you have a lot of growth hormones. Essentially, they do exactly that, just help your body grow and help synthesize cells and turnover. So growth factors also help with your skin, collagen formation, all the cells in your skin, because the cells in your skin are turning over so quickly and they're always renewing themselves. They're always, you know, you're rubbing your skin and you're losing skin cells. So it's always trying to replace itself. So if the cells slow down and they're not reproducing as quickly and they're staying on your skin longer, so then they're drying out longer. That happens with age, unfortunately. We just don't have as many hormones. The growth factors are less. So, and then the androgens, same again as you age, just as estrogen lowers and progesterone, androgens, even with men, androgens, which are testosterone, kind of fall over time. So that's, unfortunately, they all have an effect in our body. And so then the effects that they had is less and less and less. So the main effects of aging that you'll start to notice on your skin, and things, areas to nose, like around the nose, cheeks, you'll see nose and cheeks, you'll see kind of like thinning skin. So more vascularity, so more redness. So a lot of people will be putting concealer under their eye and around their nose, because that's where they have a lot of redness. Loss of structural integrity, meaning thinning skin again, a lot around the eyes, and even on the chin area also. And then really dry skin. So you'll notice you just need more and more moisture. Hyaluronic acid and everything is really beneficial for that, for aging. So another thing we do at Flourish, that's the clinic that I'm at in Toronto, we actually invested in a machine or a diagnostic device called Observe. And what it does is it actually takes pictures of your skin in 6 different light modes to help us kind of see your skin a little better and to see kind of under your skin a little bit. So it'll see things like dryness, the quality of the oils on your face, are they more inflammatory or are they beneficial oils? Really see texture, pigmentation, sun damage that you may not see yet that will appear in the next, 5 to 10 years if you're not wearing sunscreen. So for example, this is my face, so we obviously tested it on ourselves. So the first one on the left is the daylight mode. So that's something you would see when you look in the mirror. So just essentially like a good lighting. So we kind of use that as a reference point when we're looking at the other light modes. The one in the middle is cross polarization. So you're looking kind of deeper into the skin and it really highlights redness, vascularity, inflammation. Some people will have like more veins, you'll see. So just it's looking at kind of the thinness of the skin and the skin structure and quality. And then the one on the right is the parallel polarization mode. So it really highlights skin texture. And this light mode is actually only with this machine, so you won't get it kind of at every single clinic. And it looks at pore size, texture, scarring, fine lines, wrinkles. So it'll really highlight wrinkles that you may not see that are starting, that we can kind of address. And then the other modes, which are a little more scary to look at, the True UV one, it looks at structural integrity specifically in pigmentation. So when I say structural integrity, it's kind of like the thinness of your skin or how much collagen essentially you kind of have in it. And it usually happens around the eye. So as you can see, the darker purple is kind of loss of skin integrity. So focusing a little more on collagen formation and some topical things that can help, maybe topical nutrients that can help with that and kind of circulation to that area. And then the Woods light, which is actually a light mode that's over 100 years old. They used it to look at skin conditions a long time ago. It also looks beneath the skin, but we use this one to look more at lipid. So if you were to make the image bigger, you would see little red dots or little white dots. The red dots are more inflammatory type oils, and the white dots would be also oily, but maybe not as concerning. So for example, we've done it before on other people and then their face is completely pink. So it's very oily, but also maybe more inflammatory oils. So getting more fish oil, more fatty acids in their diet would be a benefit. And then the last one on the right is called the complexion mode. And it kind of takes all the abnormal findings and all the other light modes and puts them into one. And essentially it's supposed to kind of reflect if I did nothing to my skin in the next 5 to 10 years, what my face would look like. So what aging would happen is you see a lot more redness, all the sun damage. So for one take home for me was that I don't wear enough sunscreen because I feel like I tan easily, so I don't need to wear sunscreen, but you definitely do because it's damaging my skin. So we do all this for anyone who wants to kind of do skin assessments. We'll definitely do these 2 machines, that and the other one that measures moisture and oil and melanin and everything like that, and kind of put it all together into a plan. And then we also really look at, like all the kind of as an overall, we look at, your physical environment, your diet, medications and supplements, what health conditions you might have underlying that we need to address, and then what age you are. So that really plays into factor what we're going to do with your skin. But keeping in mind that mostly with a lot of skin conditions, the number one thing is to kind of restore that skin barrier defense. So making sure the microflora is good. So you're not putting on, like topical antimicrobials, tea tree oil on your face every single day. That's killing off all the beneficial bacteria. Or you're using something that's more pH high. So you're kind of throwing off the pH in your skin. You're not stripping all the oils from your skin because you do need oils. And the new trend now is a lot of oil-based cleansers, which feel weird to get used to at first, but they're actually can be really beneficial for your skin and kind of keeping it healthy. So that's everything. I don't know if there's any questions.
Do you have some favorite oil-based cleansers for people to use, or is it really, to reach out to you for a free consultation so that they know which one's best for their skin?
To be honest, there's so many. And like the skincare product, my personal one that I've tried, I don't love oil cleansers. I'm still getting used to them. But the one that I found like it's a true oil cleanser is Wildcraft. I think it's a Toronto brand. And you can get it in like a sample kit. You can order for $20 and it'll come in it. You can try it. And then we have a line at Flourish that I actually started using and really like. It's called Ella Spa. It's a medical grade, but all natural line. And it's like the mix between a foam and a gel cleanser. It's pretty mild. I like that one. Mm-hmm. But really, any oil cleanser, you'd have to try it out because for some people, the oil is too heavy and it'll block their pores. So as long as it's not, they call it comedogenic, where it's blocking your pores and it's clean, and it works for you, that's kind of all that matters.
Neat. And I know we've talked about it in the past before, but can you talk a little bit more to acupuncture and how, because we talked a little bit about hormones and age here. And I know you talked about the facial cosmetic acupuncture. What about acupuncture on your body and how might that help your skin as well?
Oh, that's a good question. So even when we do cosmetic acupuncture, we still do systemic acupuncture. So I'm trained in traditional Chinese medicine acupuncture. So it's using more that type of theory. So meridians and kind of energy flow through your body. And then it can help, certain points can help influence hormones, like you said, regulate hormones. We use it a lot for kind of like pre and post IVF actually to help balance hormones, regulate cycles, menopausal hot flashes and sleep. It's been beneficial. So yes, using, topical or using facial acupuncture points, but then tying it in with more physical ones. So if digestion is an issue, or if you do have kind of imbalance in hormones, we can do both at the same time.
Neat. And if people are on medication or have used medication before for their skin, is there anything they should take into consideration to detox their body, like Accutane? Now, how long does it stay in the body? Does it really harm your body for the future? And how can we detox that?
Yeah, that's really medication specific. So it'd be good to kind of sit with a naturopath who's trained in that, who did extra training, which I did, or even medical doctor, but naturopath because they would know how to detox from it. But for example, Accutane, it can stay in your body anywhere from like 6 to 12 months. But that's why they actually say, you don't try and get pregnant like 6 to 8 months after being on Accutane because it can still be in your body and it's very, very negative for the baby and teratogenic. So in that sense, but then also knowing, so I do have patients on Accutane where their acne was so bad and they just really wanted to go on it, knowing that it does deplete things like folic acid. So I have them supplement with the things that those medications are depleting so that hopefully it can help balance it out. And then when they come off, it's about doing more topical things. So with Accutane, lots and lots of moisture, restoring the skin barrier after they're done. And then if people are on oral antibiotics, which that's another thing they'll do for acne, is making sure we're on like a high dose probiotic and really supporting gut health and that type of thing. So just kind of mitigating the side effects is kind of a big one.
Yeah, that makes sense. And then just understanding how it's impacting your body for sure.
For sure. And if there are ones that kind of tend to linger or have after residual effects, knowing how to kind of address those. Exactly.
Neat. And then we have another question. What would you recommend for acne and dark spots on other parts of your body? Legs, back, chest?
Yeah. So pigmentation, there's a couple topicals you can do, like topical glutathione. You can do, actually IV glutathione, which we do sometimes, usually lightens all of your skin, not just that spot, but topical glutathione, and then like topical arbutin is the one I think it is. There's different compounds you can do, and we can actually, naturopaths can prescription compound topicals for you, so we can put certain things in it. But then a big thing with acne is preventing it, because sometimes you get acne and you just tend to scar. So trying to not get acne in the first place is a big thing to address it. And then wearing tons and tons of sunscreen. Because as soon as you have acne on, I'm using back, but like that's usually a place a lot of people have it, back or chest. If you have active acne and then you're not putting sunscreen on it, you're definitely going to darken those pigments with the sun. So really trying to always have sunscreen on to prevent it getting dark in the first place. And then, glutathione and topicals.
Right. And I mean, if you go back to the chart that you had before with even skin skin type, different people are more prone to scarring than others too.
Definitely. So yeah, exactly. Like that's exactly a good point. So darker skins are definitely more likely to not wear sunscreen because they don't burn, and so they're like, well, I don't need to wear sunscreen, but they're more likely to hyperpigment and to scar. So in that sense, you really want to be protecting your skin as much as you can.
And is there a different reason why someone would break out on their face versus their chest, their back, their legs, their arms? I know even people get acne on their arms and their legs, like those bumps.
Yeah, the bumps on your arms they're less acne and more, it can be from like deficiencies in certain nutrients or too much of those nutrients. It can be, sometimes I find people get on their back or chest, it can be more physical. So like wearing your sports bra and not after a workout and not changing it right away.
Hot yoga. I used to get it after hot yoga.
Yeah, hot yoga. The other day I biked with like a school bag and then had acne on. Like it's more, I find it's physical. It's more on your face. If there's certain areas on your face, we can kind of be like, oh, this is more hormonal, this is more stress, this is more, these are kind of pointed out that way. When it's on your body, it's definitely hormonal. There's something happening that way.
Interesting.
And yeah, and it could be also, if it's happening on your body, what body cleanser are you using?
Yeah.
Really chemical.
Even when I was actually in high school, I had folliculitis on my legs, which almost looked like acne.
Yeah,
because
it's super painful and burns.
Yeah,
so.
yeah. And it was so awful. I couldn't even get rid of it with like topicals. It was brutal. I ended up having to do laser on it to get rid of it.
Oh my goodness. That's when people have that, sometimes it can be from shaving your legs.
Yes. And I wasn't even shaving. I was waxing.
Oh.
Yeah. But it's still like, once I got it, I couldn't get rid of it.
It's hard. It is really, really hard. And depending on the cause, but I'll get women to like use a new razor every time. Like that's one thing too. But yeah, it can be tricky for folliculitis.
Yeah. Interesting. But yeah, ladies, I know there's a bunch of you. Oh, someone also mentioned rosacea. I know you didn't talk too much about rosacea in this presentation. Can you comment to that at all?
Yeah. So rosacea, there's some really good topicals that you can get. Actually, it's prescription, not through naturopath, but I would like send you to your medical doctor and ask if they could do it. It's very genetic. So if it runs in your family and all of your parents and grandparents had rosacea, it's really about prevention. So using things on your face, certain types of acids can help even out the texture. Usually rosacea is like on your nose, redness and like sores. You're definitely more likely for skin cancer. It's thinning of the skin, less collagen. So supporting all these things, it's really about prevention. But then once you start to get it, it's about evening out the texture and wearing tons and tons of sunscreen.
Okay, cool.
Yeah.
If that answered your question, Shen, let us know. If not, again, I put Melissa's Instagram and website in the comments below. So if you're watching, feel free to DM her, Facebook, Instagram, and book a free consultation online. And then you can chat about your specific skin things that you're having and or stress or hormones. Feel free to reach out to her. She's an expert at those as well. And then she can guide you and tell you the best course of action for whatever you're experiencing right now in your life.
Definitely.
Do you have any other comments then as we finish up? And ladies, if you have any last questions, feel free to put them in the comment section as well.
No, I don't think so. Exactly kind of what you said. If anyone has any questions, so I do kind of a 15-minute discovery call. So if you just have questions, want to talk to me about something and see if naturopathic medicine or if I can kind of help you with it, we can definitely do that. It's complimentary. And then we kind of go from there. Figure out.
Perfect. And can you facilitate people in different areas? Because I know you have your office in Toronto and Oakville. What about people across Canada or in the United States?
For sure. So I can do virtual. So right now, because of licensing in Ontario, I can only see people in Ontario.
Okay.
So limited to Ontario, but if you're in other provinces or you're in the US, I do know a lot of my colleagues from school moved all different provinces. So if you need a referral to a naturopath in different province, I would be more than happy to do that too.
Perfect. Awesome. That's so great. So yeah, thank you ladies so much for popping in. And thanks again, Melissa, for coming out and giving us all your knowledge. I did virtual acupuncture with Dr. Melissa during COVID, and now I have to go back. I want to get those skin tests. So I'm going to have to actually book that now. Yeah, that'll be fun.
Yep, definitely. Okay, thank
Cool.
you.
Alrighty. Good night, ladies. We will chat with you soon.